Hi, Dr. Yass here. In this video, we are going to discuss the idea of groin pain coming from a bone-on-bone or arthritic change from the hip joint and why this is complete nonsense. The number one symptom associated with arthritic change in the hip joint, or oftentimes orthopedists talk about being bone on bone, is the idea of having groin pain, and that the groin pain is being referred from the hip joint. Let me just show you a quick presentation of why this is absolute insanity and should never be accepted as truthful. Number one, let's look at the anatomy. Here we have your hip joint right here. This is the hip joint, the femur going into the pelvis at the acetabulum or socket. This is the ball and socket joint right here. Here is the groin region. There is no reason to think that if there was some sort of arthritic change here, that would create pain in the groin region. Muscles can refer symptoms. Nerves can refer symptoms. Bones don't refer symptoms. So if you were to have an arthritic change here, the only place that this would elicit pain would be at the hip joint itself. So what are the two primary symptoms that you could look at from a physical evaluation perspective to determine whether you are actually having pain from the joint itself? Number one, you could look at range of motion. If in fact there was an arthritic change, there would be a massive loss of range of motion, and at the point at which you could not move your hip joint any farther, it would feel like a bone's hitting another bone. That's number one. Number two, you would lay the person on the side, on the unaffected side. You would take your hand and compress the femur into the joint and see if you get pain. That's a compression test. So the two indicators relating to a physical examination as to whether the joint itself is creating your pain is a range of motion test showing that there is a major loss of range of motion, and at the end range showing that it feels like a bone is hitting another bone. This is unrelated to pain. This is strictly range of motion. Number two is a compressive test confirming that when you push down on the femur into the acetabulum or socket, you feel a greater level of pain. If you do not present with symptoms at the joint and show positives to these two tests, you cannot assert that the pain you're having, certainly in the groin, is coming from the hip joint. That's the indication of how you know it's not from the hip joint. In the next video, I'm going to show you exactly how you could determine if your pain is in the hip joint, what it is, and in most cases it's muscular, which muscles are creating that symptom. So if you like this video in terms of showing you how for sure you know that your hip joint is not the cause of groin pain, please give this a thumbs up. Stay tuned for the next video, which will come in the next couple of days. If you want to know when I actually release it, you can subscribe to my YouTube channel, Dr. Mitchell Yass, which will give you the ability to get notifications when I am putting out new videos. So look for this next video on how to determine what actually is causing groin region pain, which is muscular and easy to resolve in just a couple of sessions of exercise when you know which exercises to do and how to do them correctly with the right resistance. So if you want to get in touch with me, if you're having this issue, you can contact me at Dr. Mitch at mitchellyass.com, DRMITCH at MITCHELLYASS.com. That's Dr. Mitch at mitchellyass.com. If you actually want to have a session with me, we can do it teleconferencing-wise through either Skype or Zoom. Again, contact me at Dr. Mitch at mitchellyass.com. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Get the right diagnosis, get the right treatment, resolve your pain, be pain-free and fully functional. Bye-bye for now.